Hello guys, so this is our clinical case series. So today is our first case. In this case, a 7-year-old boy is brought to the OPD with swelling around the eyes for 5 days. The swelling is more in the morning and gradually involves the legs and abdomen. His mother also noticed frothy urine and decreased urine output. There is no history of fever, burning micturition, hematuria or hypertension. On examination, puffiness of face present, pedal edema present, ascites mild, blood pressure is 170 mmHg, weight increased by 3 kg in 1 week. Okay, so in investigations, the investigation result are proteins are present in the urine. 24-hour urinary protein is 4.5 gram per day, which is high, at the higher side. Serum albumin low level. Serum cholesterol 320 mg per dl, which is also high in amount. Serum creatinine is normal, and urine microscopy fat cast are present. So this is one of the important hint in this particular clinical case, which is a fatty cast present. Okay, so basically now we'll see the questions on the case. What is the most likely diagnosis? It is a nephrotic syndrome. So what is nephrotic syndrome? Okay, so it is a clinical condition which is characterized by massive proteinuria in which the protein is more than 3.5 gram per day. Okay, therefore it also has hypoalbuminemia, which is loss of the proteins. We can also say as there is massive proteinuria, it will lead to the albumin value decrease, which will lead to the hypoalbuminemia. After that, we will see here generalized edema and then hyperlipidemia. Okay, so the next question is, why does the edema occur in nephrotic syndrome? Okay, so the loss of protein in case of the decreased, okay, if there is a loss of protein, the oncotic pressure will decrease, therefore the fluid from blood will flow to interstitial. Okay, why the edema occur? The protein value is low, so the oncotic pressure decreases and the fluid from the blood start passing towards the interstitial space, producing the edema. Therefore, the next question, what causes the frothy urine? The frothy urine is caused by the excess of protein in urine. Why? Next question, why is serum cholesterol increased? The liver increases lipoprotein synthesis in response to the hypoalbuminemia. Okay, so as there is excess protein outflow, albumin value decreases. So to compensate the value of albumin, the lipoprotein synthesis is done, and due to lipoprotein synthesis, the cholesterol values are increased. So what are the fatty cast? Okay, so the fatty cast the fat droplets and lipid and renal tubular cells seen in urine. In short, fat droplets which are seen in the urine is called as the fatty cast. They are characteristic of the nephrotic syndrome. Okay, what is the most common cause of the nephrotic syndrome in children? It is a minimal change disease. After that, mention the complications of the nephrotic syndrome. It may be infection, thrombosis, acute kidney injury, or protein malnutrition. Therefore, the next question, what is the treatment of the syndrome? Treatment of the syndrome are the corticosteroids, diuretics for edema, adequate protein diet. Okay, then mention the classical tetrad of the nephrotic syndrome. Okay, classical tetrad is massive proteinuria, hypoalbuminemia, edema, and hyperlipidemia. Okay, so these are some short viva questions which can be asked. So mainly, which protein is lost? Albumin, as its molecular weight is very low. What urine findings is characteristic? Fatty cast. Is blood pressure usually high? Okay, usually normal in the pure nephrotic syndrome. Which investigation confirms proteinuria? Okay, 24-hour urinary protein estimation can confirm the proteinuria. Okay, so last question, which renal structure is mainly damaged? Glomerular filtration membrane is mainly damaged. Okay guys, so this is today's clinical case. I hope you understand.